Hey, I'm Caida. I'm going to be your nurse today. Can I just get you to verify your name and your date of birth for me? All right, Miss Johnson, I'm just going to check your charts over here. And it says that your doctor has ordered a foley catheter. So have you ever had allergic reactions to shellfish, betadine, iodine, or latex? No? All right, perfect. Well, what the foley catheter is, it's going to be inserted through your urethra, and it's going to kind of help void some urine, and it's going to go through a tube that is going to drain into a bag that we're going to have attached to the side of your bed over here. So if you have any questions about it, feel free to ask me, and I'm just going to kind of put you up into a working position for me, but I'm going to lay your head down to make it a little bit more comfortable for you. You're going to be exposed a little bit during this, but I'm going to try to keep you as covered as I possibly can. So I'm just going to kind of pull this down, and I'm going to drape this over you, just so you can have a little privacy. And then I'm going to pull this out, and I'm just going to wash my hands and put on some clean gloves. Okay, I'm just going to kind of roll this up, and I'm going to set your legs in dorsal recumbent position. And I've got this basin here. It's just warm water and soap. We're just going to kind of clean the perineal area. So I'm going to do 3 strokes from the top to the bottom, making sure not to use the same part of the rag twice. So one side and then the second side, and then we're going to go down the middle. All right. So now I am going to dispose of these gloves, and I'm going to start with my sterile field. I'm just going to make this into a little trash bag over here and kind of just set it next to you. Alright, so I'm going to be sure to only touch the bottom corners and make sure I don't break my sterile field. Just going to get my gloves out. And I'm only going to touch the corners here also. Okay, so I am just going to drape this underneath you. and using the shiny side under you. And I don't want to contaminate it by touching your legs. Alright. Then I'm just going to kind of drape this over you. Okay. So now I'm just going to remove this without contaminating it. I'm going to put a little bit of lubricant so we can lube the tube. Just about 2 inches, just to kind of help it guide through. And then this is my sterile water. It's just going to go here. All right, now I'm going to put the Betadine on the cotton swabs. Okay. Now I'm going to clean the labias from the left side, top to bottom, then the right side, top to bottom, in the middle, and then the middle one more time. Okay, so you may feel a little bit of discomfort. If you feel pain or you want to stop at any time, just let me know and we'll stop the procedure and notify your doctor. If I can, just get you to breathe in for me, and then once you exhale, I'm going to stick it, going to kind of push it through. So inhale, exhale. And I'm just going to push it in 2 to 3 inches until I see some urine, and then 2 to 3 inches more. Okay? So I am going to fill the balloon with 10 milliliters of, or 10 cc of sterile water. And then I'm just going to check for some resistance to make sure. All right, I feel the resistance. Okay, so I'm going to take my sterile gloves off. Kind of and I'm going to attach this to your leg here. We can use a little pad to wipe it down to help the tape stick better. And I'm going to put on some clean gloves and wash my hands and just collect a urine sample. And I'm going to take this from the bag because we just inserted the tube. But if I need a urine sample at any other time, I would take it from the port right here. And I'm going to make sure not to put the bag on any bed rails. Let me just get this in case. Okay, and how are you feeling? Do you feel any discomfort? All right, I'm just gonna kind of clean up this area around me. Dispose this. I'm gonna clean off the betadine with just warm water, and so all right, so I'm just gonna do one swipe, second, and third. Let that get all dry. And then we can lay you back down here. Just gonna cover you back up. And if you're feeling okay and everything's good, I'm just gonna go ahead and document it. So, the Foley catheter was inserted. The patient had no pain, tolerated well. It was a 16 French Foley catheter, and there was 10 cc of sterile water put into the balloon, and your urination did come out. All right, so I'm just gonna be back in a little bit to check on you. If you have any problems or you need me, just you have your call light right here. Okay. Hey, I'm Caida again, and I'm back. Can I just get you to confirm your name and date of birth for me? Okay. Well, now it looks like you are getting your Foley catheter taken out. So your doctor ordered for it, and this should be a lot easier, than putting it in, and should be simple. But if you go through any pain, once again, just let me know, and I can stop. I'm just gonna put you back up in a working position for me. I'm gonna lay you back down again. And once again, I'm just gonna kind of cover the top of you just so you're not too exposed. I'm going to put you back in a dorsal recumbent position, and I'm going to kind of place a towel underneath you just so we don't get any excess fluids in the bed or anything. Okay, so I'm just going to remove this tape. Alright, so I'm gonna wash my hands, put on some gloves. I'm gonna get my syringe over here. Alright, and I am just going to use positive pressure to take the sterile water out so that we can take the tube out. Alright, I'm just going to check and make sure it's 10. If not, then I would put it back in and pull out again until I get exactly 10. Okay? So once again, just take a deep breath for me. And I'm just going to unhook this bag. And I would make sure to drain the bag and that it had 500 milliliters of urine in it before I took this out. All right, so take a deep breath and exhale. All right, just gonna kind of wrap this up. Okay, you did great. How do you feel? You don't feel any discomfort? All right, I'm just gonna put you back down. Now I'll cover you up. And then do you have any other questions? Okay. I am just going to document that 500 milliliters of urine was in the bag before took the catheter out, that the 16 French catheter was removed and the patient had no pain or discomfort, and that I removed 10 cc of sterile water from the catheter before removal, and that there was a clear yellow urine. All right. And if you have any other questions or you need anything else, feel free to ask or use your call light.